Molecular hydrogen as a neuroprotective agent. Abstract: oxidative stress and neuroinflammation cause many neurological disorders. Recently, it has been reported that molecular hydrogen functions as an antioxidant and anti-inflammatory agent. The routes of H2 administration in animal model and human clinical studies are roughly classified into 3 types: inhalation of H2 gas, drinking H2 dissolved water, and injection of H2 dissolved saline. This review discusses some of the remarkable progress that has been made in the research of H2 use for neurological disorders, such as cerebrovascular diseases, neurodegenerative disorders, and neonatal brain disorders. Although most neurological disorders are currently incurable, these studies suggest the clinical potential of H2 administration for their prevention, treatment, and mitigation. Several of the potential effectors of H2 will also be discussed, including cell signaling molecules and hormones that are responsible for preventing oxidative stress and inflammation. Nevertheless, further investigation will be required to determine the direct target molecule of H2. 1. Introduction to oxidative stress and neuroinflammation are known to cause neurological disorders such as those following brain injury, neurodegenerative disorders, and other diseases. 1. Oxidative stress is derived from reactive oxygen species, ROS, such as superoxide anion radical, O2, times, hydrogen peroxide, H2O2, nitric oxide, and hydroxyl radical, OH times. Recently, it was reported that molecular hydrogen, H2, selectively reduces the highly toxic ROS-OH times and peroxynitrite, but not O2, times, H2O2, or nitric oxide. Moreover, inhalation of H2 gas markedly suppresses ischemia-reperfusion injury of the brain by buffering oxidative stress, too. Subsequent studies further reported the protective effect of H2 on both heart and liver ischemia-reperfusion injury. The results of these studies show that H2 has the potential to be a more efficacious antioxidant therapy than conventional choices. Because H2 rapidly diffuses across cell membranes, it can reach and react with cytotoxic ROS. Indeed, the therapeutic efficacy of H2 against oxidative damage has been reported in a number of studies since 2007. Many studies have also shown that H2 suppresses inflammation in animal models of disease induced by lipopolysaccharide, LPS, concanavalin A, dextrin sodium sulfate, or others, with decreases in the levels of pro-inflammatory cytokines, such as tumor necrosis factor, TNF, alpha, interleukin-1 beta, and interleukin-6. However, many of the anti-inflammatory efficacies and other therapeutic effects of H2 cannot be completely explained by its ROS scavenging capacity. Most O2 free radical is generated in mitochondria and converted into hydrogen peroxide by superoxide dismutase. The detoxifying enzymes glutathione peroxidase and catalase convert hydrogen peroxide into H2O. Reactive oxygen species plays physiologically important roles in signal transduction cascades and biological processes, such as apoptosis, cell proliferation, and differentiation. Nitric oxide functions as a neurotransmitter for dilation of blood vessels. However, hydroxyl free radical, the strongest reactive oxygen species, reacts indiscriminately with nucleic acids, lipids, and proteins. The hydroxyl free radical is generated by the Fenton reaction and becomes a major cause of the oxidation and destruction of molecules by direct reactions or by triggering the chain reaction of free radicals. Thus, antioxidant therapy only for hydroxyl free radical dependent injuries is required to cure the diseases derived from oxidative stress, indicating that molecular hydrogen is an ideal reductant for this purpose. The brain is more vulnerable to oxidative stress than are other organs. Antioxidants are relatively low in the brain despite its high oxygen consumption, 20% of the total at rest. Moreover, Neurons are characterized as postmitotic cells and thus accumulate oxidative damage over the years. Indeed, reactive oxygen species is suspected to be important in neurodegenerative diseases such as Parkinson's disease, PD, Alzheimer's disease, AD, Huntington's disease, and multiple sclerosis. REA. Reactive oxygen species-induced mitochondrial damage in particular is associated with the onset of PD, AD, and other neurodegenerative diseases. Neuroinflammation is initiated in response to a variety of physiological neuronal changes, such as those brought about by infection, traumatic brain injury, toxic metabolites, and autoimmunity. Immune responses cause widespread neuroinflammation, whereas they are also a major means to protect the central nervous system, CNS, from neural disorders. Microglia, resident innate immune cells in the CNS, are activated in response to these physiological changes and generate cytokines and chemokines. Although the CNS has been believed to be an immune-privileged site protected by the blood-brain barrier, BBB, some cytokines and chemokines, such as interleukin-6, TNF, and chemokine, CC motif, ligand 2, CCL2, are known to be transport for reactive oxygen species across the BBB, from the blood into the brain. Moreover, recent studies have shown that circulating peripheral immune cells called macrophages invade the CNS. The C-reactive oxygen species stalk between the signaling cascades. Underlying oxidative stress and the inflammatory responses may be a critical factor in neurodegenerative disorders. Thus, both the neuroimmunological interactions and C-reactive oxygen species stalk with oxidative stress need to be considered when contemplating mechanisms for the anti-inflammatory effects of molecular hydrogen in the brain. 3. Routes of hydrogen administration. The routes by which molecular hydrogen can be administered or taken into the body are numerous. They are roughly classified into 3 types: inhalation of molecular hydrogen gas, drinking molecular hydrogen dissolved water, HW, and injection of molecular hydrogen dissolved saline, HS. Administration of molecular hydrogen varies depending on the disease. Inhalation of molecular hydrogen gas is the simplest method and has been widely used since the first report. Inhaled molecular hydrogen diffuses into the alveoli of the lung and is transported throughout the body in the blood. However, this route of administration can be inconvenient and even dangerous because molecular hydrogen gas is explosive when the concentration in air is greater than 4%. Thus, the concentration of molecular hydrogen in mixed gas is usually maintained between 1% and 4%. Inhalation of molecular hydrogen gas ameliorates acute diseases such as ischemia-reperfusion injury and graft injury of several organs. Drinking water saturated with molecular hydrogen, 1006 parts per billion, is safer and more convenient than inhaling molecular hydrogen gas. The first report showed that ad libitum drinking of hydrogen water prevents arteriosclerosis. Reactive oxygen species is in apolipoprotein E knockout in mice, a model of the spontaneous development of the reactive oxygen species. The oxidative stress in the aorta is decreased. Nagata et al. Reported that continuous drinking of hydrogen water ameliorates the stress-induced impairments in learning tasks during chronic physical restraint in mice. Many studies have shown that drinking hydrogen water can reduce oxidative stress in several organs, including the brain, indicating that hydrogen water is useful in daily life to prevent or minimize the risk associated with lifestyle. However, the efficacy of hydrogen water administration is different from that of molecular hydrogen gas. A recent study has shown that inhaling molecular hydrogen gas and drinking hydrogen water differentially regulates signaling pathways and gene expression in mice. Injection of hydrogen saline water is also safe, without risk of explosion, and allows for the direct application of hydrogen saline water to the affected area. Although the method is invasive, Intraperitoneal injection of hydrogen saline water has shown neuroprotective efficacy against ischemia-reperfusion injury in the brain similar to that following inhalation of molecular hydrogen gas. Additionally, utilization of hydrogen-producing bacteria in the gut may be effective. For example, ingestion of lactulose produces a marked increase in the amount of molecular hydrogen gas through fermentation by the bacteria in the gastrointestinal tract. 4. Cerebrovascular diseases. Ischemia-reperfusion injury and subarachnoid hemorrhage, SAH, cause severe cerebrovascular diseases through oxidative stress and inflammation. 32. Many studies suggest that administration of molecular hydrogen is efficacious in the treatments of cerebrovascular diseases. Globally, age standard death rate of ischemic stroke is 57.3 per 100,000 persons in 2013. However, reperfusion to the ischemic brain region causes additional damage that can be more harmful than the ischemic stroke. The ischemia-reperfusion injury in the brain is a serious medical problem. To date, reports concerning the therapeutic efficacy of molecular hydrogen for ischemia-reperfusion injury are the most common among all the molecular hydrogen studies. Osawa et al. Were the first to report that inhalation of molecular hydrogen gas markedly suppresses rat brain injury induced by focal ischemia-reperfusion by buffering oxidative stress, as assessed by the accumulation of its markers 8-hydroxyl-2,4-deoxyguanosine, 8-OHDG, and 4-hydroxynonenal, 4-HNE, 2. Surprisingly, treatment with molecular hydrogen gas is more effective than that with edaravone, which is an reactive oxygen species scavenger and used in the treatment of cerebral infarction. Nagatani and co-workers reported that inhalation of molecular hydrogen gas improves the survival rate of mice from 8.3% to a whopping 50% following global cerebral ischemia reperfusion, injury by bilateral common carotid artery occlusion. These benefits of molecular hydrogen are associated with significantly lower levels of 8-OHDG, 4-HNE, and malondialdehyde in brain tissue. The administration of molecular hydrogen gas attenuates brain edema with less extravasation of serum albumin in the striatum and parietal cortex, indicating that disruption of the blood-brain barrier is suppressed by molecular hydrogen. However, Huang et al. Reported that systemic intraperitoneal injection of HS improves both 72-hour survival rates and neurological scores, reduces neuronal injury, and inhibits neuronal apoptosis in a rabbit model of cardiac arrest. Administration of hydrogenated saline water also reduces 8-OHDG and malondialdehyde both in plasma and hippocampal tissues, with an increase in superoxide dismutase and catalase activities. Importantly, injection of hydrogenated saline water significantly reduces the increase in the inflammatory cytokines illinoin-1 beta and TNF in a rat model of ischemia-reperfusion injury. Acute neuronal death during ischemia-reperfusion injury has been attributed to the loss of mitochondrial permeability transition coupled with mitochondrial dysfunction. Injection of hydrogenated saline water reduces not only tissue damage but also the degree of mitochondrial swelling and the loss of the mitochondrial membrane potential. Clinical studies have indicated that intravenous administration of a molecular hydrogen-enriched solution is safe for patients with acute cerebral infarction, including patients treated with tissue plasminogen activator, and combined administration of edaravone and hydrogenated saline water in patients with acute brainstem infarction improves MRI indices. Subarachnoid hemorrhage is a severe disease that is associated with significant morbidity and mortality. The mortality is approximately 50%, with 30% of survivors having significant morbidity. Moreover, autopsy studies have shown that approximately 5% of the patients harbored intracranial aneurysms and 10 per 100,000 had aneurysmal subarachnoid hemorrhage. In a rat model of subarachnoid hemorrhage, inhalation of molecular hydrogen gas palliates brain edema and BBB disruption, reduces neuronal apoptosis, and improves neurologic function. These effects are associated with the amelioration of oxidative injury. Moreover, injection of hydrogenated saline water attenuates subarachnoid hemorrhage-induced brain injury. Shao et al. Reported that hydrogenated saline water improves the neurobehavioral outcome after subarachnoid hemorrhage, in part via inactivation of the inflammation pathways, including the nuclear factor kappa B, NFB, pathway and the nucleotide binding domain, leucine-rich repeat-containing receptor family, pyrin domain-containing 3 inflammasome. 4. Neurodegenerative disorders. Aging is associated with an increase in the incidence of neurodegenerative disorders, creating a large problem that needs to be solved in our aging society. Oxidative stress and inflammation are leading causes of Parkinson's disease and other neurodegenerative disorders. Many studies indicate that molecular hydrogen treatment is potentially useful for alleviating neurodegenerative disorders and improving the quality of life in senior people. Pathological changes of dopaminergic neurons in the substantia nigra and nigrostriatal pathways are characteristic of Parkinson's disease and mainly disturb motor systems. The substantia nigra in Parkinson's disease exhibits increased oxidized proteins, lipids, and DNA, and decreased endogenous antioxidants, such as glutathione, whereas effective antioxidant therapy has not been established. The incidence of Parkinson's disease rises steeply with age, from 17.4 per 100,000 person-years between 50 and 59 years of age to 93.1 per 100,000 person-years between 70 and 79 years, with a lifetime risk of developing the disease of 1.5%. If you use Adderall, your risk of Parkinson's goes from 1.5 out of 100 to 1.1 out of 50. The neurotoxins 6-hydroxydopamine and 1-methyl-4-phenyl 1,2,3,6-tetrahydropyrene, MPTP, destroy neurons by generating reactive oxygen species and are used to generate animal models of Parkinson's disease. Fu et al. Reported that drinking 50% saturated hydrogen water before or after injection of 6-OHDA by stereotactic surgery attenuates nigrostriatal degeneration in a rat model of Parkinson's disease. In that study, methamphetamine-induced behavioral analysis and tyrosine hydroxylase staining of the substantia nigra and striatum revealed that hydrogen water significantly prevents the reduction of dopaminergic neurons. Moreover, Fujita et al. Reported that drinking hydrogen water suppresses the loss of dopaminergic neurons in a mouse model of Parkinson's using both acute and chronic administration of MPTP. The MPTP-induced accumulation of 8-OHDG and 4-hydroxynonenal is decreased in the nigrostriatal pathway of hydrogen water-drinking mice, whereas production of superoxide anion, which was detected by intravascular injection of dihydroethidium, is not reduced. Recently, a randomized double-blind placebo-controlled pilot study was conducted to investigate the therapeutic efficacy of hydrogen water in patients with Parkinson's disease. Participants drank 1 liter per day of hydrogen water or pseudo-water for 48 weeks. The total unified Parkinson's disease rating scale scores in the hydrogen water group improved, whereas scores in the placebo group worsened. Aging is recognized as being the principal risk factor for Alzheimer's dementia. Accumulation of misfolded proteins, such as amyloid beta and tau, in the aging brain results in oxidative and inflammatory damage, which in turn leads to energy failure and synaptic dysfunction. The incidence of the disease doubles every 5 years after the age of 65 years, with a diagnosis of 1,275 per 100,000 person-years in those over 65. The odds of receiving a diagnosis of AD after the age of 85 years exceeds 1 in 3. Sun's laboratory reported that intracerebroventricular injection of hydrogenated water prevents amyloid-induced neuroinflammation and oxidative stress, which may contribute to the improvement of memory dysfunction in a rat model. After inoculation with amyloid beta in the brain, intracerebroventricular injection of hydrogenated saline water improved learning and memory, enhanced long-term potentiation in vivo, prevented an increase in oxidative stress, malondialdehyde and 8-OHDG, and inflammatory cytokines, interleukin-6, TNF and Illinois-1 beta, and suppressed the activation of CJUN N-terminal kinase and NFB. Neonatal brain disorders. Brain disorders in neonates and infants are an important cause of mortality and morbidity, and contribute to the onset of autism, cerebral palsy, mental retardation, and a variety of other neurological and cognitive disabilities. Perinatal asphyxia is a significant cause of brain injury, leading on to neonatal encephalopathy. Even in countries with low neonatal mortality rates, 5 less than 1,000 births, the incidence of neonatal encephalopathy is 1.6 per 1,000 births. Thus, it is important to seek suitable therapies that can increase survival and attenuate the neurological deficits. Inflammation and oxidative stress are the major causes of hypoxia-ischemia injury through neuronal apoptosis. CAI et al. Reported that inhalation of molecular hydrogen gas reduces neuronal apoptosis in rat model of neonatal hypoxia-ischemia. They further demonstrated that abnormal behavior at 5 weeks after hypoxia-ischemia is improved by administration of HS. Demoki et al. Reported that molecular hydrogen gas reduces neuronal injury induced by hypoxia-ischemia ventilation in the cerebral cortex, hippocampus, basal ganglia, and cerebellum of newborn pigs. They further demonstrated that the inhalation of molecular hydrogen gas extends the survival period after asphyxia from 4H to 24H in newborn pig model, emphasizing the translational potential of molecular hydrogen gas. Many studies in laboratory animals have shown that the immature brain responds differently to treatment than does the mature brain. However, administration of molecular hydrogen to neonates with ischemic brain injury is highly effective for improving the prognosis. Moreover, Mano et al. Reported that maternal administration of hydrogen water improves hippocampal damage caused by in utero ischemia reperfusion injury at day 7 after birth via reducing 4-hydroxynonenal and 8-OHDG. Recent findings indicate that administration of anesthetics to immature brains causes pathological changes and long-term behavioral abnormalities. Thus, the U.S. Food and Drug Administration launched the Safety of Key Inhaled and Intravenous Drugs in Pediatrics, SafeKids, initiative to promote academic and clinical research. A fundamental study showed that exposure to sevoflurane induces abnormal social behaviors resembling autism spectrum in mice. However, no efficacious treatment has been found. Yonamein et al. Reported that co-administration of molecular hydrogen gas with sevoflurane in neonatal mice suppresses the increase in oxidative stress, neuronal apoptosis, and subsequent neurobehavioral deficits caused by the exposure to sevoflurane. Moreover, co-administration of molecular hydrogen gas prevents the abnormal maternal behavior later in adulthood that was derived from neonatal exposure to sevoflurane, suggesting a remarkable potential of molecular hydrogen gas for reducing adverse effects caused by anesthetic exposure. Fetal inflammatory response syndrome, FIRS, is the fetal counterpart of the systemic inflammatory response syndrome. FIRS causes severe brain injury through neuroinflammation. Recently, Nakano et al. Reported that maternal administration of hydrogen water ameliorates mouse fetal brain injury induced with maternal exposure to LPS. Expression of pro-inflammatory cytokines, oxidative damage, and microglial activation caused by intrauterine inflammation are suppressed by hydrogen water. These data suggest that prenatal administration of molecular hydrogen can be an effective therapeutic approach for FIRS. 6. Other neurological disorders. Retinal ischemia is a common cause of visual impairment and blindness. At the cellular level, ischemic retinal injury consists of a self-reinforcing destructive cascade involving neuronal depolarization, calcium influx, and oxidative stress initiated by energy failure and increased glutamatergic stimulation. Oharazawa et al. Reported that HSI drops ameliorate the rat retinal ischemia reperfusion injury that was induced by raising intraocular pressure. Topical HSI drops were continuously administered during the ischemia reperfusion periods, and they found that the drops suppressed the increase in hydroxyl free radical, reduced the number of retinal apoptotic and oxidative stress marker positive cells, and prevent retinal thinning with the accompanying activation of muller glia, astrocytes, and microglia. Kikawa et al. Reported that molecular hydrogen protects against antimycin A and cisplatin-induced oxidative stress in explant cultures of auditory tissues, suggesting that molecular hydrogen can protect against drug-induced inner ear damage. Noise-induced hearing loss occurs by transmission of too much sound intensity via the auditory system. When the ear is exposed to loud sounds for a long time, the overstimulation of the hair cells leads to production of reactive oxygen species and causes oxidative cell death. 84. A recent study has shown that intraperitoneal injection of HS protects against noise-induced hearing loss in guinea pigs. Molecular hydrogen ameliorates destruction of hair cells in part by reducing the generation of reactive oxygen species. Traumatic brain injury, TBI, and spinal cord injury cause the majority of death and disability, especially in low- and middle-income countries. The incidence of CNS injuries varies between regions, with estimates of 200 to 600 injuries per 100,000 people. G et al. Reported that administration of molecular hydrogen protects against neuronal cell death in an animal model of TBI. Inhalation of molecular hydrogen gas suppresses the increase in oxidative products and enhances the enzymatic activities of endogenous antioxidants, superoxide dismutase and catalase, in brain tissue, leading to the protective efficacy of molecular hydrogen treatment in a rat model of TBI. 87. Injection of HS was also shown to be effective against TBI via reducing oxidative stress. Dohe et al. Reported that drinking hydrogen water inhibits the edema induced by TBI and completely blocks pathological tau expression in mice. Moreover, it was reported that inhaling molecular hydrogen gas and drinking hydrogen water protected against spinal cord ischemia reperfusion injury in rabbits, with a decrease observed in oxidative products and inflammatory cytokines and an increase in endogenous antioxidant enzymatic activities. Similar results have been reported in a rat model of spinal cord ischemia reperfusion injury, in which injection of HS suppresses reactive astrogliosis and improves locomotor function. In addition, molecular hydrogen treatments were reported to protect against sepsis and ALPS-induced brain inflammation and carbon monoxide intoxication in rodents. 7. Molecular mechanisms of molecular hydrogen. Efficacy. Several lines of evidence indicate that molecular hydrogen directly reduces highly reactive oxygen species at the affected area in acute diseases. Detectable amounts of molecular hydrogen can be supplied to the brain by both inhalation of molecular hydrogen gas and injection of hydrogenated saline water. By contrast, after drinking hydrogen water, the molecular hydrogen concentration in the rodent brain is too low to be detected using a conventional hydrogen sensor. Curiously, drinking hydrogen water is more effective than inhaling molecular hydrogen gas in an animal model of Parkinson's disease. Recently, Matsumoto et al. Reported that drinking hydrogen water increases gastric expression and secretion of ghrelin in a mouse model of Parkinson's disease. Interestingly, the neuroprotective efficacy of hydrogen water is abolished by an antagonist of the ghrelin receptor, the growth hormone secretagogue receptor, GHSR, and by a ghrelin secretion antagonist. Ghrelin is a hormone that was discovered based on its ability to stimulate growth hormone release and food intake, and growth hormone secretagogue receptors are expressed in dopaminergic neurons of the substantia nigra. Ghrelin exerts neuroprotective efficacy in Parkinson's disease by inhibiting the neuroinflammation derived from microglia. Based on these results, one can speculate that higher concentration of molecular hydrogen in hydrogen water acts directly on ghrelin-producing gastric cells and regulates secretion of ghrelin through intracellular signaling. Sato et al. Reported previously that administration of hydrogen water prevents O2 times formation in brain slices of vitamin C-depleted senescence marker protein 30 gluconolactonase knockout mice, which cannot synthesize vitamin C. After these knockout mice drank hydrogen water for 33 days, O2 times formation during hypoxia-reoxygenation treatment of live brain slices from the mice was estimated using a real-time biography imaging system with a chemiluminescence probe for superoxide radical. They found that superoxide radical formation is 27.2% lower in slices from molecular hydrogen-treated mice than in control slices. Because no trace amount of molecular hydrogen existed in the slice, molecular hydrogen does not reduce reactive oxygen species directly. However, drinking hydrogen water may trigger a protective adaptive response in the brain against oxidative stress. Kawamura et al. Reported that inhalation of molecular hydrogen gas during exposure to hyperoxia improves blood oxygenation, reduces inflammation, and induces heme oxygenase 1, HO1, expression in the lung. Heme oxygenase 1 enzymatically functions in heme catabolism to yield carbon monoxide, free ferrocyanins, and biliverdin, and its transcription is regulated by nuclear factor erythroid 2 related Factor 2, NRF2. Therefore, heme oxygenase 1 participates in the cell defense against oxidative stress, and it has been speculated that HO1 may be a therapeutic target for neuroprotection. Mutations of HO1 have been associated with high risk for AD and Parkinson's disease. Moreover, several studies have shown that HO1 and its enzymatic products are associated with ischemic brain injury. In NRF2 knockout mice, inhalation of molecular hydrogen gas does not improve hyperoxic lung injury and does not induce the expression of heme oxygenase 1. Moreover, it was reported that the molecular hydrogen gas generated from bacteria in the intestine and the administration of hydrogenated saline ameliorates ischemia-reperfusion injury by activating NRF2 in rats. A recent study has shown that drinking hydrogen water prevents LPS or cytokine-induced generation of reactive oxygen species by microglia, and reduces LPS-induced microglial neurotoxicity. In most inflammatory disease models, the administered molecular-hydrogen functions as an anti-inflammatory by decreasing the expression of pro-inflammatory factors, such as NFB, TNF, Illinois 1-beta, interleukin 6, Illinois 10, Illinois 12, chemokine, CC motif, ligand 2, CCL2, interferon, and intercellular adhesion molecule 1. In the brain, neuroinflammation is likely induced by microglia. Activated microglia generate pro-inflammatory cytokines and reactive oxygen species. The authors of a previous report speculated that heme oxygenase 1 and its product carbon monoxide suppress microglia activity and the generation of inflammatory cytokines and reactive oxygen species. At present, we consider the C-reactive oxygen species stalk between antioxidative stress pathways, such as NRF2, heme oxygenase 1, and the anti-inflammatory response to be the most important molecular mechanism for the protective function of molecular hydrogen, and that regulating microglia is a key mechanism for molecular hydrogen efficacy in the brain. Recently, Yuchi et al. Demonstrated that low concentrations, approximately 1% VV, of molecular hydrogen modulate Ca2+ signal transduction and regulate gene expression by modifying the production of oxidized phospholipid species. Because molecular hydrogen is the smallest as well as a nonpolar molecule, it is unlikely that molecular hydrogen could bind to some protein mediators. Further investigation will be required to determine the direct target molecule of molecular hydrogen. Conclusion: although many neurological disorders are currently incurable, numerous studies suggest the clinical potential of molecular hydrogen administration for the prevention, treatment, and mitigation of these disorders. To our knowledge, no adverse effects of molecular hydrogen have been reported, and molecular hydrogen is relatively easy to use, inexpensive, and effective in daily medical practice. However, The optimal route and dose of molecular hydrogen administration for each disease remains to be established. To do so, elucidation of the molecular mechanisms underlying the biological effects of molecular hydrogen will be essential for developing molecular hydrogen as an effective neuroprotective medicine.